Welcome to the NovaSound Hearing and Balance video series. Our whole goal here is to break down these really complex topics, hearing, balance, auditory processing, into clear, practical information that you can actually use. This is presented by Dr. Saeed Malieri, audiologist and the founder of NovaSound Hearing and Balance Center right here in Halifax, Nova Scotia.
At the end of the day, it all comes down to our simple goal: better hearing and better balance, because that leads to better living.
All right, let's dive into our first section, where we're going to talk about some of the most common but often unseen symptoms that can show up after a concussion.
I just want to ask you something directly. Since your head injury, do you ever feel kind of dizzy or off balance in a busy grocery store? Do everyday sounds sometimes feel just overwhelmingly loud? Or maybe you find yourself really struggling to keep up with conversations, especially somewhere noisy like a restaurant. If you're nodding your head to any of this, you're in exactly the right place.
And you are definitely not imagining it. Research actually shows that more than half of people who've had a head injury report these exact same kinds of auditory symptoms. The most important thing to take away from this is that if you're feeling this way, you are absolutely not alone. It's a very real and very common experience.
But here's the puzzle, right? So many people go and get a hearing test and they're told everything's normal. And yet the daily struggle is still there. It creates this really frustrating gap between what you're feeling and what a standard test is telling you. So what is really going on? That's what we're about to unpack.
Okay, so let's clear up that huge point of confusion. Why would your hearing test come back perfectly normal even when you know deep down that something just isn't right?
Well, here's the fundamental difference. The best way to think about it is like this. A standard hearing test is checking your hardware, your ear's basic ability to detect a sound, like a simple beep in a quiet room. But an auditory processing assessment, that's checking your software, your brain's ability to actually understand and make sense of what you're hearing, especially when things get noisy and complicated.
And this brings us to the real core of the issue. The problem isn't necessarily in your ears at all. It's happening in your brain's ability to process sound. This condition actually has a name. It's called Auditory Processing Disorder, or APD. And maybe the simplest, most powerful way to think about it is this. APD is what happens when the brain can't hear, even when the ears are working perfectly fine.
Let's just walk through how this works, okay? So step 1, a sound enters your ear. No problem there. The hardware is good. Step 2, a nice clear signal travels up the nerve to your brain. The connection is solid. But it's step 3 where the breakdown happens. After a concussion, the brain itself can really struggle to process the meaning of that signal, to filter out background noise, to follow quick conversations, or just to make sense of everything all at once.
So why does this happen? Well, a concussion is a huge event for your body. The amount of physical and psychological stress it creates can literally disrupt the very delicate systems that connect your hearing and your balance to your brain. It's kind of like a communication breakdown between two departments that used to work together perfectly.
And I want to be really clear, this is not just a feeling. It is a measurable physical change in the brain. Studies using fMRIs have actually shown that after a concussion, there can be lower activation in the parts of the brain that handle hearing. What's more, the connection, that communication highway between the left and right sides of your brain's hearing center can be reduced. So what you're experiencing has a very real neurological basis.
So knowing the problem is in the brain, how do we actually get a clear picture of what's happening? Let's talk about how we uncover the root cause.
The process we use here at NovaSound is a really clear, structured path. It all starts with an in-depth consultation, where we just listen and understand your specific experiences. From there, we move into advanced testing that goes way beyond a standard hearing test. We're looking specifically at brain processing and balance. This lets us pinpoint the true root cause, and that leads us straight to the most important step, a personalized recovery plan that's built just for you.
So, who is this really for? Well, it's for anyone with those lingering post-concussion symptoms. It's for people who feel that dizziness in busy places, or who've suddenly developed a new sensitivity to sound. And it's especially for those of you who feel like you can hear just fine, but you just can't understand when you're in a noisy real-world situation.
And that brings us to the final, and honestly the most hopeful part, your path to recovery. Because getting a diagnosis is that first crucial step, but what comes next is what really changes things.
The goal of therapy isn't just about learning to cope with your symptoms. It's about actively helping the brain to heal. A targeted recovery plan uses specific exercises and strategies to literally retrain the brain's auditory processing abilities.
This can reduce things like noise sensitivity and really improve your ability to communicate and just function with confidence again. We're essentially helping the brain rebuild those connections that got disrupted from the injury.
So I want to leave you with this final thought. For years, you might have been straining, just trying so much harder to keep up. But what if the key to better hearing and better balance isn't about trying harder at all, but about retraining your brain to work smarter?
If you're experiencing dizziness, sensitivity to sound, or any of these listening difficulties after a concussion, we can help you figure out the cause and, more importantly, guide your recovery.
Thank you so much for watching this NovaSound Hearing and Balance video. We're proud to be Halifax's first private clinic that offers advanced vestibular diagnostics, APD evaluations, tinnitus and hyperacusis care, and audiology services for all ages.
You can visit us at novasound.ca or give us a call at 902-444-7788. Better hearing, better balance, better living.